Okay, so what is the exact title of your job, and how many years have you held your job?
I am currently a special education coordinator with Franklin County Public Schools, and this is my fifth year holding that position.
Okay. Do you enjoy what you do?
Yes, I do. I enjoy it tremendously. It's great that I can make a difference with children with special needs and be an advocate and voice for them.
I got you. I know a lot of people that actually are special education teachers, and they said that it's so much fun with the special education kids because they're more like dependent and what is the word I'm looking for? Like they express their feelings in a different way almost.
They do. They do. And my expertise is in early childhood, which is basically preschool children with special needs. So that to me is even a great advantage because I'm able to make a difference at a younger age, and
Yes,
they've
ma'am.
shown that early intervention is crucial during that time.
So you work with preschoolers basically.
I do, yes. I wear many hats, but I'm the coordinator of our early childhood special ed program. But I also work at Lee Wade Elementary School, and I also help service the K through 5 special education population there as well.
I got you. Um, so what is your educational experience to be able to hold this job?
Um, so for this job, it's very, my path to being a teacher is, I guess, what you could call non-traditional because I did attend Ferrum, and while I was at Ferrum, my degree was in sports medicine. So I became a physical therapist, and then I was in the school system, and I'm like, ooh, I like this, but I also like the early childhood special ed population. So I switched careers, kind of. And I went to Radford and got my degree along with my master's in early childhood special education. So that was kind of a 3-year process to get my teaching degree and master's all together from Radford.
I got you. I'm actually looking into being a physical therapist myself, and I go to
Nice.
I go to Ferrum, and when you said that's really the reason I chose you, it's because we're supposed to pick somebody that in our field. I saw that you majored in sports medicine,
Yes.
so um,
So to let you know, I can speak to either the education part or I can speak to the physical therapy part. Just let me know which way you want this
well, I
conversation to be happy.
I can tie in anything. I just have to tie
Okay.
it in with my major. So whatever you want to talk about is fine with me. Um,
Okay.
what made you want to do what you currently do?
Well, so as we had talked about, I started out in the physical therapy realm. And so when I got my physical therapy degree after leaving Ferrum, we were contracted out. I was in a private practice and we were contracted out through the school system. So I was actually in Franklin County Public Schools doing physical therapy. And a majority of the children in that early childhood special education population receive physical therapy. So I was in their classrooms a lot, working with the teachers, also working with other grade levels, middle and high and elementary in the physical therapy world, and was like, I just wanted to get into the education realm and still be able to make a difference in that population. As well as I was married and getting ready to have kids. So the pull to be on the school schedule and have summers off was really appealing to me as well, and as far as the family. So I pursued that route and fell in love with it, and then just kind of worked my way up to the special education coordinator position that I'm in right now.
I got you. Yeah, it seems that most people that either go part time or into the school systems do it because of their children, so they can have more time at home with their families and their kids.
Hmm.
I know that my mom, she started working part time when I was little, so she could be at home with me and my brother more.
Yes.
Um, so you obviously have to report to someone. Who would that be?
Well, I report to two people. So my office is housed within a school within Lee Wade Elementary School. So ultimately, the principal of that building is my boss. But also from a special education standpoint, I would report to the director of special education of Franklin County Public Schools.
That I did not know that they had directors for all of this in the school system. Like I'm from Halifax, Virginia,
Uh-huh.
and I'm guessing we have the same thing, but I did not know that.
Yeah, yeah.
Um, so what are some ethical guidelines that you must follow? Example, in the medical field, you'd follow HIPAA guidelines. I'm sure it's the same in special education. Like you can't tell the students uh, personal information.
Correct. It is. We are even cautious and abide by HIPAA guidelines when we're speaking to other coordinators, other teachers, even principals in our building. Just very cognizant of telling any information regarding a child's disability to anyone. We even tell teachers to try and keep it amongst themselves. And then with special ed, it's a little more difficult to do that because sometimes in order to understand why a child is behaving the way they are or having some difficulties, you have to let the disability known to the teachers so that they can understand that more.
Yes, ma'am. I'm sure the teachers need to know because if a kid starts acting up in class, they need to know why. But
Mhm.
you can't tell other students or people that don't need to know.
Correct. Yes.
I got you. Um, what do you find to be the best part about your job?
The best part about my job, I would say, is being able to make a difference with these children and to be a voice and an advocate for them because some of them can't communicate at all, have no language, verbal skills at all. So we get them early, we get them as young as 2. So even then, I mean, just being able to see them say their first word or being able to communicate is huge.
Yes, ma'am. That was a big part of why I wanted to get into physical therapy was to help other people.
Mhm.
A little bit about me. In high school, I had shoulder surgery. I'm a baseball player at Ferrum,
Mhm.
and um, I had to do physical therapy, and I just saw what they were doing with everybody in the clinic, and I was like, I want to do that. I want to make a difference in that way.
Yeah, it's pretty cool. And that was one of the reasons I chose to go into physical therapy. And I did a lot of internship hours when I was at Ferrum with a local physical therapy place in town. And then I ended up going to Jefferson College of Health Sciences to get my PTA
Yes,
license. And it's just was, I enjoyed it. I enjoyed it immensely. I guess my favorite was working with pediatrics, which I really like. And then doing my rotations in the nursing home. I know that's kind of, may not be a lot of people's forte, but I really liked the young kids and I liked the old people. The in between, didn't
the
really care for.
the in between can get a little stubborn at times and not want to do stuff.
They can, and they say, the older generation kind of reverts back to being a kid. So I guess that's why I like, the kids and the older kids, so to speak.
Well,
So,
I did a shadowing experience in Roanoke last year, and the older people, it's cool because you can't just say do a bicep curl like that. You got to show them what to do. So
uh-huh.
I thought that was kind of fun too.
Yeah.
Um, so we'll revert from the best part. Would you have any cons about the current job you hold, or do you enjoy every aspect of it?
Be cons with every job that you have. That's my personal opinion. But definitely the pros outweigh the cons. Obviously, that's why I'm still doing what I do. Some cons for education is that sometimes you're bound by budgets. There's a lot of things that you would like to do that would be in the best interest for the kids, but you're bound by the budget. And then sometimes, honestly, dealing with people and parents can be difficult. It's not actually the children, but you know, some meetings, IEP meetings, can get contentious with parents, and that's the cons of the job, because I don't really like confrontation. But we always try to keep every meeting in confrontation. Okay, this meeting is about this child, and we want to do what's best for this child. So we try and keep that in the forefront of everything, and that kind of helps as well.
Yes, ma'am. So let's go to more recent times. How did this whole coronavirus thing affect your job or students or whatever, however it could have affected you? How did it?
Crazy. I mean, it's unbelievable. It was and still is a challenge, especially, I will say, in the special education world, because our children are so small. Again, 2 years old until 5 years old. For us to try and do anything virtually with them is very difficult. A lot of their IEP goals, which is what we base our instruction on, is stuff like potty training, feeding skills, learning to pay attention, learning to sit through a story, sharing and taking turns, some social skills. So all of those goals are almost difficult to address virtually. So we had to become very, very creative. We do a lot of face-to-face meetings in the special education world with referral meetings and IEP meetings. So all of those had to become virtually. And then we also had to, you know, up the ante on our technology skills, because, you know, there are some people, me, who is not very technology savvy. And so when all of this went virtual, then you had to kind of, whether you liked it or not, you had to, you know, up those skills in technology.
Yeah, I would like to say I was, but then we did all this online stuff and I was not anywhere near where I thought I was. I know
Yeah.
for I know for younger kids though, a lot of them learn by like lip reading with words
Uh-huh.
and letters. So I'm sure that was hard for them because they weren't able to see y'all in person and read your lips,
Mm-hmm.
because they literally mimic what you do. So
Yeah, it was very difficult. And then we, you know, we didn't have a lot of parent follow through either, which was typical countywide, not just for the population that I serve, but I can speak. I have a high school, well, I have a child who just graduated from high school and one who was in 8th grade. My daughter loved it. She loved the virtual aspect of not having to get up and go to school and deal with people. Whereas my younger kid, it was like pulling teeth to get him up to do stuff. So it's interesting to see how different people adapt to different situations that we're in.
yes, ma'am. And it's hard in a county like Franklin County because it's so big and not everybody has access to internet. So that also is hard. I have one final question and then I'll end the recording. What is some advice to people that want to get into the job that you currently hold?
So my suggestion, and this would be for a physical therapy route, or this would be for a teaching route, I would definitely volunteer in any of those. You know, volunteer in a physical therapy setting, like you were saying that you did. Get in some classrooms. And physical therapy, get into an outpatient setting, work with pediatrics, work with in a nursing home setting. That will just broaden your expertise, as well as give you an idea of what you want to work in. As far as education, get in the elementary level, middle, high school level, get in special education, because, you know, you can sit in the classrooms all you want and learn things, as you probably know, but you learn the best and the most when you're out in the field observing and getting some hands-on experience.
Yes, ma'am. All right, I'll stop the recording.